traveled to the Philippines to train midwives on how to use ultrasound technology.
Yeah, it's all part of a plan to help expecting moms have safer trips to the hospital. Mary is at Holy Cross Hospital in Layton with Erica Brown, who helped these midwives provide better health care.
Yeah, Erica Brown here is the one who went to the Philippines, and it's part of a humanitarian project. We're in an ultrasound room right here because we're talking about the machine.
Yep.
And you, how long ago did you go to the Philippines?
So the first time I went was last February, and then I just got back for my second time last month.
Okay.
So it's fresh.
Okay, and you go there with a machine and you try to teach people how to use it?
Yes.
Are these healthcare providers?
Yeah, so not a machine like this. The machines that we're using when we go there are going to be portable, handheld. That's kind of what makes ultrasound so valuable in a setting like the Philippines.
Right.
Geography is spread out over a lot of islands, so we have to be able to get into the communities to do what we do. So it's a little bit different. And the Life Matters International helps with funding for purchasing those machines for municipalities, as well as then along with it. So.
And you teach them so they
Yeah.
can then do it, and you also have to, they provide the portable machines.
Yeah. So we have sonographers. There's 2 on a mission, and we go and we help teach the midwives that are already there locally. And then kind of the beauty of that is that because it's an extended program, takes about the course of a year overall, we really get those midwives up to scratch on the types of ultrasound that we do, so that they in turn become instructors and travel with us.
Right.
And which is great too, because it shows the midwives as kind of an example of, hey, I can do this. It's hard at first, but look at them. They made it. We can do it too.
And you kind of create a web coverage. Right?
Yeah. So we go to different. So far, I think they're on their 6th location, 6th island.
And how far apart are these? I mean, they're pretty rural.
Right.
Yeah.
When in the Philippines, they have municipalities, and then within, it's like a county, and then within that, there's what they call barangays, which are like individual health units that are really the rural areas. So one municipality might cover multiple islands even. And so that's what makes ultrasound so cool, is it can be portable. So you can put a tool into these midwives' hands that they can go literally into people's homes to be able to bring it to them.
What kind of people did you meet?
So most of the trainees were midwives, men as well as women. The doctors, usually the municipal health officer, were usually also involved. They learn as well, and a couple of nurses. And then lots of patients, lots of Filipino women. Lots of moms, lots of families.
And what's it like to tell someone or to let someone see their baby?
It's awesome. And I think it was refreshing for me. I love my job. I love what I do. But it was a breath of fresh air to go and have people that were both patients and providers that were so excited about what we do, what we have, we take a little bit for granted. So
on your monthly checkups, you get to see your baby here.
Yeah,
it's
not
rare.
the same. Most of the patients, at least on our first time missions, they'd never had an ultrasound before.
Nice.
So it was a first. So they're obviously super excited. But equally, the midwives are so enthusiastic about learning because they love their patients. They're kind of the beating heart and soul of their communities. So they want to be able to provide this to them, and they recognize the value in it for finding things that can affect both mom and baby in terms of mortality.
Well, and it lets you know how far along you are, so you can be close to a hospital when it's time to deliver.
Exactly, because a lot of times, we would go and, a patient would guess based on their period, they'd be 10 weeks, and we'd scan them and they'd be 16 weeks.
Okay.
Well, in that case, it's something like you say, as simple as knowing when to make that long journey to get to a birthing center or a hospital at the correct time so that you're not in labor while trying to do that.
Can you show us how this works? You said you have a portable way of doing it.
So same premise in that, much smaller, usually a laptop size. You've got a screen, you've got transducer, different ones for different purposes. So a curve would be for OB. Gel is the key. You got to have gel or it won't work at all.
It's always cold.
Yeah, well, this one's a little bit warm, but it is cold in the Philippines.
Okay.
So, and then, hang on, I got to get out of that. And switch over.
Yeah, we had those pictures up because it was a...
Yeah, it was a baby. So that's one of the ones that we typically see. Come here, you. There we go. So with ultrasound, sound waves going in, making a picture. Not much to see on my hand, a couple bones at the top. But yeah, so the gel is what provides the contact to be able to form the picture. And in the case of an OB, like early on, you'd be seeing, you know, like just a sac. And then later on with baby, as baby gets bigger, you're seeing a baby and all the organs and the heartbeat and all that good thing. And that's what they get the most excited about, is being able to see that movement and that heartbeat is really meaningful to them. Especially, like I say, when we take it a little bit for granted here, it's very routine. But most of the time, they're not getting that opportunity. Yeah. So it was just a great opportunity to go with Life Matters to be able to provide that for them.
So how many people do you think you've impacted with this?
So I think they're on their 5th mission right now. We usually train about 12 midwives each site. And then, like I say, then they go on to become trainers and spread that out. They're starting another 2 missions this summer. So, I mean, that's at least 500 midwives. Yeah. And then you spread that out over their municipalities. Tai, which is one of the places we just went, had a population of 90,000. Wow. That 2 doctors are serving total. So that population alone is going to have something that they've never had access to before. And it's awesome. I just love it.
Okay, Erica, how can people learn more about
So so Life Matters International.
Life Matters International.
Yeah,
okay.
They have a website, lifemattersinternational.org. They're celebrating right now, getting ready for their 5th anniversary of doing these missions. So they are actively fundraising to be able to help both fund the midwives taking their exams to become certified, machines, and to help with the travel expenses of getting people there to teach.
Okay. And so far, just the Philippines?
Just the Philippines so far.
Okay.
But you never know.
Amazing. You're helping so many people.
I love it.
Thanks for sharing.
Yeah, no problem.
How it all works.
Appreciate
and good luck
it.
on your next missions.
Thank you.
Okay. Pretty cool. From Holy Cross Hospital Davis here in Layton. Back to you guys.
All right. Thank you so much, Mary. Appreciate it.
All right. Remember, you can watch ARC Salt Lake anytime on your phone, tablet, or TV. Just check out highlights from all of our newscasts on the ARC Salt Lake YouTube page at the QR code right there. It'll take you right to it.